Good afternoon, everyone. My name is Jazman Cireus, and today I will be presenting my final policy recommendation for addressing racial disparities in maternal mortality in the state of Maryland. Throughout this class and this project, I evaluated three potential policy solutions designed to improve maternal health outcomes and reduce disparities among Black women. Each policy addressed an important aspect of maternal health care. However, after carefully weighing their strengths, limitations, and long term impact, I selected the policy that I believe offers the greatest opportunity for sustainable, system wide improvement. Throughout this presentation, I will briefly review the three policy options that were considered, explain why I selected my final recommendation, discuss why I believe it is the best option for healthcare clinicians, identify its greatest selling points for policymakers and advocates, and conclude with my final recommendation. To begin, I'll introduce the three policy options that were evaluated. The first policy I considered was mandatory implicit bias training for healthcare professionals. The purpose of this policy is to increase providers' awareness of unconscious biases that may influence clinical decision-making and interactions with patients. The goal is to improve communication, strengthen provider and patient relationships, and reduce disparities in care. While provider education is certainly important, research suggests that education alone does not always produce lasting improvements in healthcare outcomes if it's not paired with broader organizational changes. Then we move on to maternal health accountability and reporting requirements. This policy would require healthcare organizations to collect standardized maternal health data, monitor maternal outcomes by race and ethnicity, identify disparities, and implement quality improvement initiatives based on those findings. Rather than focusing on only individual providers, this policy emphasizes improving healthcare systems through accountability and continuous evaluation. We then move on to the third policy, which is extending postpartum care throughout the first year after giving birth. Many pregnancy-related complications occur after delivery, yet many women lose access to healthcare services during this critical period. Extending postpartum coverage would improve access to follow-up care, chronic disease management, and mental health services and preventative care during the first year after birth. Each of these policies addresses an important piece of the maternal health crisis. However, after evaluating their overall impact, I determined that there was one policy that provided the strongest foundation for improving maternal health care over the long term. To determine which policy offered the greatest opportunity for meaningful change, I compared their strengths and weaknesses. To make an informed decision, I compared each policy's strengths and limitations using recommendations from the American College of Obstetricians and Gynecologists, commonly known as ACOG, as well as findings from Njoku and colleagues, who examined the strategies for reducing Black maternal morbidity and mortality in the United States. The first policy, as previously discussed, was mandatory implicit bias training. The advantage of this policy was increasing provider awareness and encouraging more culturally responsive care, and recognizing that unconscious bias can influence clinical decision-making and patient experiences. However, although education is valuable, it does not always produce measurable long-term improvements unless healthcare organizations also implement systems that monitor outcomes and evaluate progress. We'll move on to the third policy and come back to the second one. So we move on to extending postpartum care through 1 year after childbirth. This would improve access to healthcare services during that critical period of time and would likely improve the continuity of care and help providers identify medical or mental health concerns after delivery. However, it does not directly address how hospitals measure healthcare quality or identify disparities within their own organizations. The third policy, as you can see, is the policy that I selected, was maternal health and accountability and reporting requirements. This stood out because it creates a system-wide improvement method rather than isolating interventions. Standardized reporting allows healthcare organizations to identify disparities, evaluate patient outcomes, monitor progress over time, and implement evidence based quality strategies. So, again, after comparing all of these options, I concluded that maternal health accountability and reporting requirements provide the strongest opportunity for creating that sustainable improvement that we were looking for in maternal health care. Now that I've explained my decision, I'd like to discuss the specific reasons why I chose this policy over the other two options. I chose this policy because it addresses maternal mortality at the health system level rather than focusing solely on individual providers or individual patients. According to the systematic review conducted by Hailu and colleagues, structural racism contributes to adverse maternal health outcomes by influencing healthcare systems, access to care, and the quality of quality of services that patients receive. Similarly, Njoku and colleagues argue that reducing Black maternal mortality requires systemic solutions rather than individual behavior change. One of the greatest challenges in reducing maternal mortality is that healthcare organizations cannot improve problems that they are not consistently measuring. Standardizing reporting provides reliable data that allows hospitals to identify patterns in maternal outcomes, recognize racial disparities, and evaluate whether interventions are actually improving patient care. This policy also promotes transparency and accountability. By requiring healthcare organizations to routinely monitor maternal outcomes, leaders then become responsible for identifying areas needing improvement and implementing evidence based solutions. Another reason I selected this policy is because it supports evidence based decision making. Rather than relying on assumptions or isolated experiences, these healthcare administrators and policymakers can use objective data to determine where resources should be invested and which quality improvement initiatives are producing meaningful results. All in all, I believe this policy provides the strongest foundation for reducing racial disparities in maternal mortality because it creates a systemic change that continuously measures, evaluates, and improves the quality of healthcare in maternal healthcare. Now, while improving these systems are very important, it's also important to consider how this policy benefits the clinicians responsible for delivering maternal care. In the next section, I'll discuss why I believe this policy is the best choice for healthcare professionals. So, again, this policy is designed to improve healthcare systems, but it also provides significant benefits for clinicians responsible for delivering maternal care. Rather than placing the blame on individual providers, maternal health accountability and reporting requirements help identify opportunities for improvement across the entire healthcare system. For example, standardized reporting can reveal delays in diagnosis, communication breakdowns, inconsistencies in clinical practice, or differences in patient outcomes among hospitals or patient populations. These findings allow physicians, nurses, midwives, doulas, administrators, quality improvement specialists, and others to work collaboratively to develop solutions. Another important benefit is that this policy encourages evidence based practice. Instead of relying solely on personal experience or assumptions, clinicians can use outcome data to evaluate whether current practices are effective and then make adjustments as necessary. Ultimately, clinicians are better equipped to provide safe, equitable, and high quality care when they have accurate information, organizational support, and a healthcare system that is committed to continuous improvement. Now, clinicians, again, are essential to implementing this policy. However, the greatest impact is felt by the patients that they serve. So, I'll then discuss how this policy improves outcomes for the mothers and families. According to Hoyert's 2026 report from the Centers for Disease Control and Prevention, maternal mortality continues to be a significant public health concern in the United States. These findings highlight the urgent need for policies that improve both the quality and consistency of maternal health care. By requiring reporting, healthcare organizations can identify disparities before they become larger problems. Hospitals are able to recognize trends, evaluate patient outcomes, and implement targeted interventions that improve maternal safety and reduce preventable complications. Patients also benefit from more consistent clinical practices, greater organizational accountability, and improved quality improvement initiatives. These efforts over time contribute to safer pregnancies, improved maternal health outcomes, and greater confidence in the healthcare system. Perhaps most importantly, though, this policy helps ensure that every patient, regardless of race, ethnicity, or socioeconomic status, has the opportunity to receive equitable, high quality maternal care. After discussing the benefits for both clinicians and patients, I'd now like to explain why I believe what this policy's greatest selling point is, and why I believe it deserves to be prioritized by policymakers. When considering which policies should receive the greatest support from healthcare leaders and policymakers, I believe the strongest selling point is accountability. As emphasized by the American College of Obstetricians and Gynecologists, improving maternal health care requires organizations to continuously evaluate the quality and equity of care they provide. Accountability ensures that improvement is not a one-time initiative but an ongoing effort. One of this policy's greatest strengths is that it creates measurable results that can be tracked over time. Rather than simply implementing new programs, healthcare organizations can evaluate whether those programs are making a meaningful difference. Another selling point is that it ensures healthcare organizations remain accountable for maternal health outcomes. This encourages hospitals to regularly review their performance, identify disparities, and implement quality improvement strategies when necessary. This policy also helps guide funding and healthcare resources toward hospitals and communities experiencing the greatest disparities. By using reliable data, policymakers can make more informed decisions about where investments will have the greatest impact. Finally, standardized reporting provides the foundation for future maternal health initiatives. As new policies are developed, healthcare leaders will have objective evidence to determine what is working, what is not, and where additional improvements are necessary. Ultimately, I believe this policy creates a stronger, more equitable healthcare system because it makes accountability, transparency, and continuous quality improvement central components of maternal health care. I'd now like to conclude by summarizing why I believe this policy is the strongest recommendation. In conclusion, after evaluating the 3 proposed policy solutions, I recommend supporting maternal health accountability and reporting requirements. This policy creates the strongest foundation for improving maternal health care because it promotes accountability, transparency, and continuous quality improvement. It supports clinicians by providing meaningful data, strengthening evidence-based that strengthens evidence-based practice. And although mandatory implicit bias training and extending postpartum care through 1 year are both valuable strategies that can be used alongside this, I do believe they are most effective when implemented within a healthcare system that consistently measures outcomes and holds organizations accountable for improvement. Reducing racial disparities in maternal mortality requires more than good intentions. It requires measurable action, ongoing evaluation, and a commitment to health equity. By prioritizing accountability and transparency, this policy provides the strongest opportunity to create lasting improvements in maternal health care throughout the state of Maryland. Thank you so much for your time and attention, and I appreciate the opportunity to present my policy recommendation. These are my references.